Hello everyone, let's talk about pulmonary tuberculosis, also known as TB. Pulmonary TB is an infectious disease caused by the Mycobacterium tuberculosis bacteria, primarily affecting the lungs. It is one of the most common infectious diseases worldwide, particularly in countries with higher populations and lower access to healthcare. TB is a serious health concern because it spreads through the air when a person with active TB coughs or sneezes. While it can affect other organs, it most commonly attacks the lungs, leading to serious respiratory problems. Pulmonary TB is diagnosed through various tests, such as chest X-rays, sputum tests, and the tuberculin skin test. If left untreated, TB can cause severe damage to the lungs and other organs and can be fatal. A key factor in the diagnosis of TB is primarily caused by the bacteria Mycobacterium tuberculosis, but it requires specific conditions to become an active disease. Here are the major causes. Close contact with an infected person. TB spreads through airborne droplets from an infected person when they cough or sneeze. Weakened immune system. People with weakened immune systems, such as those living with HIV/AIDS, are more susceptible to developing active TB. Poor nutrition and lifestyle. Poor diet, smoking, and alcohol use weaken the immune system, increasing the risk of developing TB. Living in crowded conditions. Conditions like overcrowded living spaces, poor ventilation, and unsanitary environments can increase exposure to TB bacteria. Let's look at the risk factors for contracting TB. Weakened immune system. Conditions like HIV, cancer treatments, diabetes, or use of immunosuppressive drugs can make one more susceptible. Living or working in high-risk areas. Those living in or working in healthcare facilities, prisons, shelters, or refugee camps are at greater risk. Age and genetics. Both young children and older adults are more susceptible. Genetic factors can also play a role in how the body responds to the infection. Smoking. Smoking can damage lung tissue and significantly increase the chances of getting active TB. Alcoholism and malnutrition. These factors weaken the immune system and increase vulnerability to infections, including TB. Now, let's talk about the implications of TB. Pulmonary TB can lead to persistent cough, sometimes with blood in the sputum, chronic chest pain, fatigue, weight loss, and poor appetite, night sweats and fever. If left untreated, TB can progress to severe conditions such as lung damage, which may cause long-term breathing difficulties. Multidrug-resistant TB, MDR-TB, which is harder to treat and requires more intensive care. Complications in other organs, including the kidneys, spine, and brain, especially if TB spreads beyond the lungs. The good news is that pulmonary tuberculosis is preventable and treatable with the right interventions. Prevention: get vaccinated with the BCG vaccine, which helps prevent severe forms of TB, especially in children. Ensure good hygiene practices, such as covering your mouth when coughing and sneezing. Ventilate living spaces to reduce the spread of the bacteria. Avoid close contact with people who have active TB, especially in enclosed spaces. Treatment: antibiotics. TB is primarily treated with a combination of antibiotics over a period of 6 to 9 months. It's essential to complete the full course of treatment, even if symptoms improve, to prevent drug resistance. Follow-up care: regular follow-up visits with healthcare providers to monitor progress and prevent the development of drug-resistant TB. Support: good nutrition, exercise, and adequate rest help strengthen the immune system during treatment. In conclusion, pulmonary tuberculosis is a serious condition that affects millions worldwide, but with proper care and precautions, it can be managed effectively. If you have any symptoms of TB, especially a persistent cough, seek medical help immediately. Early diagnosis and treatment can save lives and prevent the spread of TB to others. Thank you for watching this health awareness video on pulmonary tuberculosis. Stay safe and healthy.